I would like to welcome you to my channel, That Middle-Aged Lady. My name is Denise, and in today's video, I wanted to talk about the side effect of breast tenderness and safety when using the Vagifem 10 milligram tablets that come preloaded into a disposable applicator for vaginal atrophy, or as it's also commonly referred to as genitourinary syndrome of menopause. This is a follow-up video to two previous videos that I've already uploaded. The first just went into detail about what vaginal atrophy is, or GSM, who's most susceptible to getting it, what the symptoms are, what the current treatments are available today, and how I was diagnosed with this condition. And then the second video was after I had been on Vagifem for 3 months and went back in to see my gynecologist to have a pelvic exam done to see whether or not the Vagifem seemed to be working. And so if either of those sound like something you'd be interested in hearing more about, I hope you'll check them out. But the reason I wanted to do today's video is because I've been receiving some comments from women who have been experiencing some breast tenderness when using Vagifem, and they're just concerned about the safety of it. I have also experienced the breast tenderness. I started to notice it about a week or two after using Vagifem. It's not been severe. My breasts aren't sore to the touch. It's nothing like when I would have my period, back when I was having periods, but rather every once in a while I'll just kind of feel like this little ping of tenderness or soreness, and it happens in both the breasts. And so being concerned about that, I did decide to question my doctor when I went in for that 3-month checkup. And the main question I had was, if very little estrogen actually makes it into the bloodstream, then how come I'm feeling it in my breasts? I could understand if I felt it in my vagina, since that's where the tablet's getting inserted, but how come I'm feeling it all the way up in my breasts? And so my doctor first said that the side effect of breast tenderness when using Vagifem is very common and nothing to be concerned about. He also said that the breasts are very susceptible to feeling any type of hormonal change, and even the slightest rise in estrogen levels can cause that tenderness. He said that just as with any medicine, when you're on it long enough, your body begins to adjust to it, and eventually that side effect should go away. But my other question was, how come some women experience it and some women don't? And he said that question is definitely a harder question to answer since there's a lot of variables that go into it. He said, for instance, it depends on where a woman's at in her menopausal process, how long she's been postmenopausal. He said some women are just more sensitive to feeling these different types of things. He said it could have something to do with breast size, it could have something to do with health. He said there's just a lot of variables that go into it, and so that's really hard to answer. And so the takeaway I got was that it's very common to feel breast tenderness when taking Vagifem, that it's a side effect that some women feel, some women don't, but that it's nothing to be concerned about. And so the other thing is, I also received a comment from a woman who stated that her doctor told her that anytime you experience breast tenderness, that means you have too much estrogen in your body. And so basically it's like an overdose, and that's not a good thing. But that confused me because, for one, I have done countless hours of research on the subject, relentlessly questioned my doctor about all the different questions I had, and never have I read that, never have I been told that, never have I heard that. The other thing that confuses me about that is that the whole point of us taking the Vagifem is because we actually have an estrogen deficiency, meaning when we went through menopause, our body wasn't producing enough estrogen anymore, therefore allowing the vaginal atrophy to take place. And so it's not that our estrogen levels were normal and we were taking more estrogen on top of that, then I could see having, an overdose of estrogen in our body, but that's not the case. We're taking the estrogen to replenish the estrogen that's been lost after going through menopause, so that that level can be what it should be, before we went through menopause. And so I was a little confused about that comment. But I think basically what this comes down to is that, we all have to do our own individual research. We have to go to our doctor with any questions or concerns we have, so that we can be educated about the side effects, be educated about the safety of it. There was one site in particular that I went to that was the National Library of Medicine that actually had a really good article on there. It was a study that was performed from the Vagifem. So it talked about the side effects, it talked about the safety, it had statistics on there, like 350 women who took it for a year, how many out of that 350 actually came down with cancer. And then the conclusion of that was basically that it is an ultra low dose. That's quote unquote, not a term I came up with, but rather how they refer to this. Ultra low dose, where very little of it does get absorbed into the bloodstream, and the amount that does is so insignificant that doctors aren't concerned about it. And so because of that, it is safe to take. And so definitely very informative, definitely gave me some reassurance. And so If you don't mind Googling, you can always just put in National Library of Medicine and then maybe / how safe is Vagifem 10 milligram, and hopefully it'll bring you to that site if you're interested in reading that for yourself. But I also think that we have to, weigh how bad are our symptoms, how much relief are we getting from the Vagifem, and how bad are our side effects. In my case, the burning was by far my worst symptom. It wasn't just once in a while. I felt it all throughout my day. It was very bothersome. And then I also had the urinary symptoms of urinary urgency and then also bladder infections. And since being on Vagifem for 3 months, I can say that those symptoms have 100% gone away. And so in my case, a little breast tenderness every once in a while to have full relief from those symptoms that I was feeling is worth it to me. I guess, I think what a lot of women are worried about, myself included, is, the C word, cancer, and whether or not this is going to lead us to getting cancer. But again, all the research I've done has shown that it's such a small amount of estrogen that is getting absorbed into the bloodstream that it shouldn't cause any, concern for bringing on cancer. The difference between this type of treatment, the Vagifem 10 milligram that's inserted into the vagina, is staying in the targeted area. And so yes, a little bit's going to make it into the bloodstream, but not enough to be worried about. Whereas when you take, say, an oral dose of the hormonal replacement therapy, that's systemic, meaning it gets circulated all throughout the body. And so that's when you have a lot more concerns that doctors really have to monitor you a little bit more closely and be a little bit more concerned about that. But that's not the case with the Vagifem. And so, again, I think it just depends on where you're at, if you're, really getting relief from this and whether you want to take that chance. The way I look at it is that there's a lot of women that get both breast cancer and cervical cancer every year that have never even, looked at a hormone replacement therapy. And so cancer is unfortunately part of life that regardless of, what's going on in your life can happen. I feel like, if one of us did come down with breast cancer or cervical cancer, there is not a definitive 100% way to say that it was positively caused from the Vagifem. It'd be different if, we lived in a parallel universe where we had this version of ourselves that didn't use the Vagifem, this version of ourselves that did, and then see if one of them comes down with cancer and then maybe have a little bit more proof. The other thing I consider is that there's been a lot of research done about this, a lot of statistics reported about this. And, like the one out of 350 women, only 2 reported cancer. And again, who's to say they wouldn't have came down with that cancer even if they weren't on Vagifem? And so that's one of those things that, it's a little bit tricky because there's no positive, definitive way to know. And so I think the best thing that we can do if we're going to go ahead and stay on the Vagifem is to just stay proactive, make sure and go in for those annual pap smears, go in for those annual mammograms, do those self-breast exams, be in tune with your body. So if you notice any changes or something that doesn't feel right, you can go to your doctor right away and question him or her about it. I think that, early prevention or early detection is key, because I think too many times in life, we'll feel something and we know it's not right, but either we, or don't want to be bothered with it, or we don't want to bother our doctors with it. Maybe we don't have insurance, whatever the case may be. And eventually a small problem turns into a big problem, and then there's no way to go back in time and to reverse what is now going on. And so if you feel something, if you're worried about something, that's what the doctors are there for. And I just think it's important that you question your doctor and not be, afraid to do that. That's the whole point of them being there. And so again, I think it's an individual choice. I think it's up to each woman to decide what is best for her. And I think you just have to get to the point, especially if you're like me and have a lot of relief from it, that you're not going to worry about, getting cancer, and that you're going to put that in the back of your mind. I mean, if I'm on Vagifem, maybe I'll get it, maybe I won't. But if I'm not on Vagifem, maybe I'll get it, maybe I won't. Well, before taking Vagifem, that's why I went for my annual mammograms. That's why I do those self-breast exams, because it's always a concern that, am I going to get breast cancer? Am I going to get cervical cancer? Am I going to get colon cancer? But that's why we go for these screenings, so that if we did, we can get that early detection and hopefully save our lives. And so that's where I'm at in the process. And again, all you can do, I guess, is just question your doctor, do your research, and then try not to worry about it. Sometimes I think stress and worrying is just as bad for us as anything else. And to be honest, if you think about it, cancer is associated with some of the food we eat, with the air we breathe, with the chemicals we use. There's a lot of things that are associated with cancer, and yet we still eat that food, we still breathe this air, we still use those chemicals. And so if you're getting relief from it and you feel confident that very little of it's getting, absorbed into the bloodstream, you go for those annual screenings, then, I guess that's, something that you really have to think about and decide what's going to work out best for you. And so that is it. I want to thank you again for joining me. I think it's great that we're talking about this, even though I can't tell you what's best for you and you can't tell me what's best for me. At least we're sharing our experiences and our thoughts, and hopefully that kind of makes us all feel a little bit better about being on this treatment and where we're going to go from here. And so I just want to thank you again, and I'll look forward to seeing you next time.